Hello, I am Dr. Bharat Bhosle. I am a medical oncologist and also I passionately look after the lung cancer patients, and I have recently been to Zurich Hospital for the fellowship in advanced lung cancer. पिछले 2 दशकों में कैंसर में बहुत सारे बदलाव आए, especially if I talk about lung cancer. If you look before 10 years there were hardly any options, but now with the precision oncology, which we call as a personalized care, every patient gets a different option. The most important step is the diagnosis and getting the right biopsy from the right location and do the diagnostic test including the NGS. So इससे क्या होता है, बहुत सारे mutations होते हैं. So if you pick up those mutations, there is a high chance that you have an option of treating the lung cancer patients with simple pills. Then immunotherapy. Immunotherapy has definitely changed the way we used to look at the lung cancer. What this immunotherapy does, it takes out the brake on the immune system. Naturally, what happens, everybody has an immune system which takes care of the bacteria, viruses. Likewise, the immune system takes care of the cancer cells also. But these cancer cells are very smart. They suppress or put a brake on the immune system. By giving immunotherapy, you are taking up the brake, or you are releasing the brake. You are accelerating the immune system, and your immune system is taking care of the tumor. So as long as your immune system is activated, taking care of the tumor, the disease remains suppressed, and we have patients who are in complete remission or cure beyond 10 years. So this is what in the last 5 years, the targeted therapy, the immunotherapy or the precision oncology, doing the diagnostic test, doing the genomic profile, see what mutation is there on the lung cancer. If there are some biomarkers which we can predict that immunotherapy was better, almost 50% of those patients we are not giving chemotherapy. We are treating them with these therapies, and they are much better than the chemotherapy. Now the main problem with these things is you need to have expertise to do all these diagnostics, which are costly. Now the treatment is also very costly. The newer the drug is very effective, but at the same time it is very costly. And what happens, there is a data from Tata Hospital where they looked at whether our patients are getting access to these drugs. The answer is no. More than 90% of the patients are not able to get these drugs, and the simple reason is the high cost. And this is not something which you have to take for 5 or 6 months. This is a recurring cost every month. And some of the patients, even with the brain metastasis, are living beyond 5 years. So imagine a patient has to pay more than ₹1 lakh, sometimes 5 lakh rupees. There are drugs which cost 10 lakh rupees also, and they have to keep on taking it. Then comes the question, are we curing these patients? So even if the effect is 100%, we are not curing these patients because patients are not buying this drug only. These are very costly drugs. In India, this was the biggest problem. 97% of the patients were not having access to the standard of care just because you don't have money. There comes the importance how we can come together and help these patients. Various NGOs are working on that, doctors are working on that, but we all have limitations. So what is happening nowadays? The NGOs are helping. There are some compassionate programs where the companies also do understand we have to provide these effective drugs. There are different programs where the patient gets 1+1 program where they have to buy a few drugs, they have to get free some of the fractions. There are some advocacy groups where patients are also part of the discussion, the caregiver are also part of the discussion, and the NGOs as well as the pharma also is coming forward to support how we can bring a change from a non-accessibility to the accessibility. There is a advocacy group, Lung Connect, where patients are discussing their real life problem. Each patient has different types of problem. To get the drugs, standard of care, sometimes problems are very simple. Patients are from the rural areas, they don't know how to travel to the cities. That is also biggest problem in India. I personally see patients are uneducated, they don't know how to contact. Sometimes the drugs are free, but they have to make some few calls, they have to write some forms, and they don't know how to read it. So that is also, I feel, a biggest obstacle in getting the right treatment. So what I personally feel the advantage of advocacy group, as I mentioned, when we come together and discuss all these problems, this becomes an important platform to discuss these questions or queries of different patients, and then this can be discussed with the policymakers, the governments and different agencies, the authorities who decide the drug cost, and there can be a big change. And definitely there can be a pressure put by this advocacy group on the government as well as the policymakers, so that the drugs can be available to all the people at their doer steps. And I feel with all the kind of people coming together, and obviously with the effective drugs, these non-curable diseases are becoming chronic, and people will live more. Actually, people are living, with the lung cancer, as I mentioned, with the brain metastasis, are also living more. And some in the future, near future, I feel that we will treat the lung cancer as like hypertension or diabetes. People will be taking simple pills. So almost 50% of the people we are treating like that. So please do join Lung Connect.